Hi, I'm Natasha, a registered nurse and care management strategist. I help healthcare organizations implement technology supported care management models that improve patient outcomes while also increasing practice revenue. And I teach nurses how to build care management businesses aligned with how healthcare is actually being reimbursed today. Today, I'm going to walk you through something a lot of nurses don't even realize is an option: how to start a care management business, because most nurses think their only options are working in the hospital, working in a clinic, or picking up extra shifts. Other nurses who want to start a business usually look at the most common routes like med spa or home care agencies. But there is another path, and it's built around what you already know how to do. Let's start with why this opportunity even exists. Healthcare is changing. We're shifting away from a system that only pays for visits to one that supports ongoing care. And CMS, the Centers for Medicare and Medicaid Services, has introduced programs like chronic care management, or CCM remote patient monitoring, or RPM. These programs are designed to improve outcomes for patients with chronic conditions. The goal is to reduce hospitalizations, improve disease management, support patients between visits. But here's the gap: providers don't have the time or the structure to manage all of this on their own. They're seeing patients back to back all day. And once that visit ends, there's no one consistently following up. That's where the breakdown happens. And that's exactly where nurses come in. As a nurse, you already have the clinical skills. You understand patient education, care coordination, chronic disease management, how to assess and identify risk. You've already been doing this. The difference is, instead of doing this work inside a facility, you can build a business around delivering these services and partner with providers who need this support. Let's talk about what that actually looks like. One of the main ways nurses build a care management business is by partnering with primary care providers. Here's how it works: you connect with a provider or clinic, and you offer to implement and manage their care management program. You're not replacing the provider, you're extending their care and becoming an integral part of the care team. You help them identify eligible patients, enroll patients into services like CCM or RPM, provide ongoing patient follow up, manage care plans, coordinate with other providers, track and document services properly. Now, think about a primary care office with 500 patients. A large portion of those patients have chronic conditions: diabetes, hypertension, heart disease. Those patients qualify for ongoing care. But without a system in place, they're only being managed during visits. Now you come in as the nurse care manager. You build that structure. You follow those patients monthly. You track what's happening with them, and you help keep them stable. That's value. And in return, you are paid for delivering those services. That payment can be structured in different ways: per patient or monthly contracts. And at the same time, you're helping the practice grow while improving patient outcomes. Now, let's talk about another model, because not every nurse wants to work with providers. There's also concierge care management. This is a direct to client model. Instead of working through a clinic, you work directly with patients or families. These are often high risk patients, older adults with multiple conditions, families trying to manage complex care situations, and they're overwhelmed. They don't know how to coordinate care. They don't understand the system. They don't have time to manage everything. That's where you come in. Clients pay privately for your services, and you provide ongoing support, care coordination, advocacy, education, help navigating the healthcare system. This is more personalized, more high touch, and it gives you more control over your business. Nurses are uniquely positioned for this work because this is not just about tasks, it's about understanding the patient, building trust, recognizing changes, coordinating care across systems, thinking critically. This is how nurses are trained to think. We don't just follow instructions, we assess, we connect the dots, we anticipate problems. That's what makes care management effective. So when you think about starting a care management business, you're not starting from scratch. You're leveraging what you already know and aligning it with where healthcare is going. There is a real need for this work. Providers need support, patients need guidance. There is a gap between the two. Care management fills that gap, and nurses are in a strong position to lead it. So if you're a nurse and you're ready to learn more about care management and how to step into this space, I share more inside my online school community, Empower Care Academy. I'll leave the link below so you can join us. Make sure you like this video, subscribe to the channel, and I'll see you in the next one.